Well, I'm Tara Beck, and I'm the mother of Mackenzie. We adopted Mackenzie. So we took her from the hospital, home from the hospital, when she was about 3 days old. We noticed when Mackenzie was about 4 months old, we noticed at church the other kids were all sitting up, and some were even clapping and looking around, and our baby was not doing that. So we knew that maybe, we weren't reaching the milestones that we should have been. So we talked to her family doctor, and we were referred to the CDSA, and they had got the ball rolling to have Mackenzie tested to see, and she qualified for some services to help her reach these milestones. Mackenzie started physical therapy. She was not able to sit up like the other children, and this was around 6 months of age. She wasn't able to hold her head up. And her occupational therapist said, I know of something called hippotherapy. And we had never heard of hippotherapy, had to research it, but we said, really? And she said, that would help Mackenzie more than anything. And she said that a horse's gait is quite similar to what her gait would need to be. And so it would teach her and her muscles how, and strengthen them as well, of how she needed to be able to walk and do the things that she needs to do for her age. So we started coming, and when she first got on the horse, it was hard to watch. As a mom, it was hard for the physical therapist to watch because her tone was so low. She could not sit up there by herself, could not hold her head up. So she couldn't look around at me. She was so exhausted from riding the horse, and it looks like she wasn't doing a lot of work, but she was. And over time, she got stronger and stronger. Within weeks, we saw progress. She was sitting up, she was, and she'd already been standing some, but she was not able to walk on surfaces without a lot of support. So she started getting more stable, and then we just saw her take off from there.
So Mackenzie is just an amazing little girl, and she's got an amazing family, and I will say our kids all have these amazing families. Her occupational therapist had been a volunteer with us one summer and had identified Mackenzie before she was old enough, because we don't put kids on there unless they're at least 2. Mackenzie couldn't get up from the floor. She was starting to walk, but you had to essentially set her on her feet, or it would take her quite a while to be able to work herself from the floor to a standing position. She couldn't go up and down steps. 2.5-year-olds typically can do those things. By putting her on the horse, it really magnified how weak she was, how weak her trunk and her postural control was. And it was painful. It was painful to watch. And she started only tolerating 10 minutes. The second session, she maybe was on the horse 15 minutes. And then the third and fourth session, she was able to tolerate pretty much a 30-minute session on the horse. We had to use some special pillows we call boppies. They're actually nursing pillows, but we could stack them up so she would not fall forward in her face on the horse. And we actually had to do that for just a couple weeks, and then she got enough strength in her core to hold herself up. It took her probably 2 months before she would actually engage with toys. All of her energy was in holding herself upright, and that's all she could attend to at the time. But I would say after the 2-month point, she has just really taken off. We don't have to use any kind of additional support. She can do activities forward and backward. Being backward is very, very difficult. And now she is able to tolerate a full session. She is engaging with her therapist and her sidewalkers. She's reaching to both sides. She's doing a lot of midline activities. With her type of neurologic issue, that is very difficult for her to integrate both sides of her body, and for her to go from one side to the other, to reach outside the center. Her center of gravity is difficult for her. So she is getting really empowered and brave now on a horse.
I've been in education for 15 years. I've taught K2 for 15 years, and I wasn't prepared to have a child with special needs. Although I had children with special needs in my classroom, it's different when you're sitting on the other side of that table. It's hard to hear as a parent. You want them reaching the milestones and putting all the accomplishments that they have on, Facebook and everywhere. And when they're not, you feel like you failed sometimes as a parent. You feel helpless. And that's why, you know, I talked to a friend and she said the best thing you can do for Mackenzie is to build a support system for her, the biggest support system that you can. And that's why we started all the therapies. We went to all the doctors that we could, the neurologists, and had the tests done. And we decided on hippotherapy, and that is a huge piece of the support system for us. Had we not had it, I don't know that she would be walking independently at this time.